So good morning, everyone. And first and foremost, again, I want to thank all the first responders out there, the men and women that are on the front lines keeping us safe. Can't thank you enough. To everyone that's an essential employee out there doing their job, keeping us moving forward. Thank you, thank you, thank you. Again, it takes everyone to pitch in to keep us moving in the right direction. And I was talking to our sanitation workers this morning when I was coming out of my house in the city, and thank them for the job that they're doing a day in and day out. And again, trash has to get picked up. We have to keep moving in the right direction. So thank them for everything they're doing, and especially our COs and everyone else working in jails across the state of New York that are on the front line every day besides what's going on today. So thank you to everyone that's doing. Unfortunately, sadly enough, we had someone pass away yesterday. It was a female in her 90s with multiple health issues. So my condolences and heart goes out to the family. You're in our prayers, and sorry that you're going through this. And to the other 29 families, same thing. We're still thinking about you, and we're sorry for your loss. So this brings our total up to 30. So it's not easy. It's not easy when we get this information, and regardless of their age. I had some people question, well, they're in their 80s and 90s. It doesn't matter. We still love these people, and it's someone's mother, grandmother, sister, aunt, friends, what relative. It doesn't matter. It doesn't matter. It's a sad situation, and my heart and condolences goes out to the family today and to the other 29. So, as of today, we have 739 positive cases. That's up 26 from yesterday. We have 772 people under mandatory quarantine. That's up 59 from yesterday. And we have 54 people under precautionary. That's up 13 from yesterday. Again, I want to remind people as that continues to change, with the mapping and tracing that we're doing and the aggressive testing. At our Shaker Place nursing home, as of today, we have 27 residents who have tested positive and 13 employees. Like I said a couple days ago, we are aggressively testing and staying on top of this for the workers and first and foremost for their safety and health and for the residents. That's our job. That's what we have to do. And if you look at the national trend, it's a tough area that we're fighting up there, and the staff and everyone's doing an awesome job. And my heart goes out to all the staff members up there coming to work every day doing their job under a lot of stress, taking care of our most vulnerable citizens. So thank you to everyone at Shaker Place. Again, I think of you every day. We have 1,825 people that have completed quarantine. Of those, 401 tested positive. So take the 401 away from the 739. That's how many people have recovered from this. That was a question on Facebook, so I just want to let people know. 31 people have been hospitalized. That's down 2. For a hospitalization rate of 4.19, which is down from 4.62 yesterday. And we have 7 adults currently in ICU that are Albany County residents that are down by 2. So again, we feel we're starting to plateau, but we're not sure. In our county, our numbers are going to go up as testing comes back because we're aggressively testing more than most other counties in the state right now. We have a lot of testing sites going on. We got the mobile walk-up, which you can call the number, area code 518-465-4771. Area code 518-465-4771. I know some people initially were having issues getting through. I called personally myself, didn't say who I was, and it took me less than a minute to get an appointment. So we're working them hiccups, and they're doing a great job at Whitney Young. I can't thank them enough. But again, the call volume that's coming in is, they have to go through all the procedures and make sure that you have either health care insurance or you don't, or like I said, the county will pay. As of all the mobile testing sites, like I said yesterday, it was 250. Today we're a little over 300. Dr. Whalen was correct. There was 365 that signed up, but out of the 365, at that point only 250 were tested. As of today, there's roughly a little over 300 that actually showed up for their appointments and got tested. And because of the wind conditions yesterday, we had to shut Warren Street down a little bit early because of the winds, and that's something else. The Rite Aid in Colony has been a huge success. I was talking to Supervisor Paul Mahan yesterday. It's been great, and we've been tracking them numbers. But again, you can go to www.riteaid.com. That test is a lot quicker because you administer it yourself in the car. They hand you the test kit, you do the swab of the inside of your nose, and you hand it back, and it's quick and painless. So we have that. And I just want to remind people, please, the social isolation, and I know it's difficult. I understand people are getting cabin fever. The only good thing about this cold weather that I can take away, because I'm tired of the cold weather, it's keeping people home. You know, it worries me when we start hitting them 60-degree days and 65-degree days where people are going to want to be outside more, enjoying the weather. You know, just please keep your 6 feet. Remember the law. Got to have a mask on. If you can't keep, the only time you got to wear a mask, and I want to make this clear when you see people walking, is if you can't keep your 6 feet distance from other people. And that happens on crowded, you know, it might be on the rail trail, you might be downtown Albany working, then you should wear a mask, you know. But if you're out in your streets and you're walking around with your wife or your spouse or your loved one or your children, and you're staying away from everyone, you don't, you know, I would recommend you to wear a mask, but if you don't, you don't. I know some of the issues people talked about. I use a cloth. I do have asthma, so I was coughing with the other mask. The fibers were getting in my throat and constantly making me cough. You know, so I had to switch over because I had to be careful, because it does feel like it's restricting your breathing. That was a question we had from some people, and I was struggling with it. I was no different than anyone else. That cloth or the mask, all the stuff was making it hard for me to breathe, and taking that in and constantly was making me cough for that reason. So I had to switch it up. So there's different options out there that you can utilize. I would recommend that, especially if you have asthma or you know, you just feel like, you know, self-contained. Being a firefighter, I'm used to having a mask on, so that was kind of easier for me. But again, the fibers were getting me, and I was having a real hard time with it. So there are options. Look at the options out there. We encourage people to continue to make homemade masks, get them out there to the community. Thank you for doing all that. I can't thank you enough. And to all the leaders around the area who've been doing great things, thank you so much. Thank you. But Dr. Whalen.
Thank you, County Executive McCoy. So we continue to see our numbers plateau, which means we are still getting about 20 to 30 new cases per day, but we are not seeing any spikes, and we are similarly not seeing a rise in inpatient admissions. Luckily, in Albany County, the rate of hospitalization has been very low. Again, I'd like to stress that those that are suffering from other medical conditions that may need hospitalization, please remember the hospital is the best place to get care, and follow up with your primary care physician on what you should be doing to manage your health. We want people to stay healthy through this to the extent possible. And it's very important to continue to manage your underlying health conditions through this pandemic. So make sure you are getting your medication refills, make sure you are checking yourself to the ability at home. Many providers in the community have telehealth services, so reach out to your doctor if you have a need to follow up on a chronic medical condition, to make sure that you're doing everything that you can do to keep yourself and your family healthy. We have been watching the rate of positives over the past few weeks, and I know I had mentioned that as the testing increased in Albany County, we would be watching very carefully that number, which for a long time had been about 7 to 7.5% of people that were tested were positive. It's inched up a bit, but not much. We're about 9.8% of people that are being positive. This means roughly 1 in 10 people that get tested for COVID in Albany County are testing positive. We continue to monitor this. We also look forward later this week to the results of the antibody testing that went on throughout the state that will give a better idea of what the upstate asymptomatic positive may be, people that may have had COVID and not know. That information is going to be very helpful going forward with the planning. Finally, I just wanted to address our nursing home. We have been working very carefully with them to ensure that they have what they need. As you know, all nursing homes very early on in the start of when we started to get COVID cases were mandated to wear surgical masks. And surgical masks are a good method of source control. Now that they are seeing cases of COVID-19, we are ensuring that the providers that are caring for people have the resources that they need, which include N95 masks. To get the right-sized N95 mask, you need something called a fit test as a healthcare provider, and we are working with them to ensure that all their workers are fit tested and that they are supplied with everything that they need. As through every single stage, they have been very proactive and very involved on making sure that they're implementing every infection control measure available.
Thank you, Dr. Whalen. So I do want to thank a couple things. I had the opportunity to go on Troy Innovative Garage yesterday with a lot of community leaders from around the community, and I want to thank Tom Nardacci for that. There was a lot of people that participated in it from different backgrounds, from business to arts to a variety of restaurants, you name it. Obviously politicians, everyone was on there, and we really just talked about what's going on in our community, and especially not just the economic impact, but the impact it's having on people in general, and what it's going to look like when we reopen businesses, how things are going to develop over the course of the next couple months, and how people envision it from the respective areas that they represent, how it's going to go. So I do want to say, Tom, thank you for sharing all that stuff. It was a great meeting yesterday. Also, I want to thank our Youth Bureau and the New York Army National Guard for delivering the toys and puzzles, and the Albany County Legislature for helping out with that. I know they want to do more, and I appreciate that, everything that they're doing, helping out with that, but I especially want to thank the National Guard and our Youth Bureau and the Legislature for doing what they're doing. I had a nice conversation last night with Chairman Andrew Joyce for like an hour and 45 minutes, but who was counting, Andrew? I was. But it was a great conversation. It really was. We actually tackled a lot of issues and things that we're dealing with budgetarily, and how they can be supportive of what Dr. Whalen and I are doing. So they really appreciated the leadership role that we've taken, and just want to really support us going forward and what we need to continue this mission that we're doing. And one of the things I did stress to Andrew, and he liked the idea too, is the mobile testing that we're doing, all the testing, aggressive testing that we're doing in here. Which brings me to another topic that I had a nice conversation with my counterpart in Rensselaer County, Steve McLaughlin, and the county chair in Schenectady, Tony Jaginski, and talked about helping them with mobile testing and helping their communities, because we are close. We border each other in Saratoga, and what happens there obviously has an effect on us here in Albany County. And it's like the governor says, as you open up things and you look at going forward, we all have to make sure we get testing done for all of our constituents, but most importantly, we have to do this where we open up in the right way and get back on track. I do want to also thank the Regional Food Bank of Northeastern and the Times Union Center for really all the food they've been delivering and everything that they've done to step up. So I can't thank both organizations the same thing. As always, our mental health hotline is always there for everyone. 7 days a week, 8 a.m. to 8 p.m., area code 518-269-6634, 269-6634. And thank you to everyone down at the mental health department for what they're doing and helping people get through this. And as always, please, we got the 211 number, the New York State hotline, and again, thank you to Capital OTB, and thank you to WGXC 90.7 for them. They're broadcasting this too, and helping us get the message out. So I can't thank everyone that's here getting the message out and continue to educate people. And that's it. We have to continue to educate people in the right way so we can move forward and open back up and get people back to work. But that's going to be working together in a partnership with everybody. So I do want to thank everybody. And again, my condolences goes out to the family that lost their loved one last night, and to the 29 other families. Our condolences, and we're there for you. So again, thank you.